So let's do it. Dr. Pauline Long, thank you so much for your time and for joining us here at Facebook Live. So for those who are new to me, my name is Leslie Garcia, founder of Counseling Space. And at Counseling Space, we offer mental health services for business owners and businesses. That is really our primary focus. And we do that through advocacy, counseling, and education. And we are evolving to be in spaces and create spaces where we destigmatize mental health. And we want to humanize the importance of mental health. And Dr. Pauline is a strong supporter about mental health awareness, prevention, education, and that's why I want to have her here to talk about medication, mental health, and more. So thank you so much.
Thank you so much for having me. I'm excited to be here.
I'm excited. So a little bit about Dr. Pauline Long. She is a pharmacist based out of Alabama. She is a graduate from Stanford University School of Pharmacy, serves on the board of directors at the Minority Women Pharmacists Association, and the co-owner of MedsPLUS Consulting, which is a healthcare consulting firm doing innovative, great, amazing healthcare services, particularly when it comes to medication management, wellness services, personalized healthcare plans. But please, I know I left out so much, and I did that intentionally because I want you to really share with us the amazing work that you're doing when it comes to healthcare, what people need to know, and a little bit more about what you do too.
Well, thank you so much for having me, Leslie. I'm excited to have this conversation tonight. Again, I am Pauline Long. I earned my doctor of pharmacy degree from Stanford. I've been a practicing pharmacist now for about 15 years. And about 3 years ago, I became a licensed consultant pharmacist. And so our primary services that we offer at MedsPLUS is chronic disease education. So for those patients who've been diagnosed with chronic diseases such as diabetes or high blood pressure, hypertension, we educate them because as healthcare professionals, we know that a patient who's educated on their health has better outcomes. So that's our one of our primary services. We also offer medication management. And that's primarily for people who, there are many patients who take 8 or more prescription medications for many chronic disease states. So medication management is a way to sit down and have a conversation regarding their chronic conditions, as well as the medications that they're on, just to make sure that we optimize that medication therapy. So we want to remove any medications that they don't need, remove medications that may be causing unwanted side effects, and just make sure they're on a streamlined, optimized medication therapy. And the last thing that we offer that I'm very excited about, and you kind of alluded to, is pharmacogenomic testing. And it's a testing that kind of looks at your DNA and determines what medications may be best for you based on the way your body metabolizes certain medications. So that's kind of in a nutshell what we do at MedsPLUS.
Thank you so much, and definitely want to hear more about the testing, the medication testing, and it's called pharmacogenetic testing, right?
That's a mouthful. It is a mouthful.
So when it comes to mental health, to give an overview, mental health is really your state of well-being, your psychological health, how you handle stress, how you relate to others, your just emotional well-being. And basically everyone has mental health, right? People need to know, just like physical health, everyone has mental health, but not everyone has mental health condition, right? That is the dysfunction of your mental health. And so I would say the stigma is definitely getting better as we're removing the stigma. I would say we're getting there, but we still have room for improvement. But if you look back 10 years ago until now, we're in a better space because we have open conversations about mental health. You have many artists and athletes talking about mental health, and also they're disclosing that they're going to therapy. But there's still a stigma. There's still a stigma, even though the conversation is happening often on different platforms. People are still hesitant. Many people are still hesitant to seek help, or many people don't even know that they need help. And people are, the research shows that people wait an average of 8 years or so to finally seek help, or when they realize that they need help. And here at Counseling Space, we work with a lot of professionals. The majority are either in high stressful environment, work environment, business owners, managers, CEOs, and they never, we have close to about 80 to 85% of our clients, they never had treatment, never had therapy. So they're new to us. And so that's a big step for them to finally come in. They're the helpers in their right at their jobs. So it was a huge step for them to come forward and say, I know I need help. Mm-hmm. And the common conditions that we're seeing now, they're saying about 46 million people suffering from mental illness, 1 in 5 in America. But the top 2 major conditions, top 2 common mental health conditions are depression and anxiety. Would you agree?
Absolutely.
Dr. Pauline, right?
Absolutely.
And that's what we see as well. It's either depression, anxiety, burnout, chronic stress, and those are the common. And it's actually stated that depression is now considered the 4th leading cause of disability. And people need to know that if it's untreated and you need help, it's compromising. Of course, it's compromising your mental health even worse, but it also compromises your physical health as well. And it takes years off of your life. They say about 5 years, you live shorter, untreated. Mm-hmm. So I say that to say, even though we're having more conversations about mental health and there are people who are open to therapy, it's still a stigma. Mm-hmm. Now, this is what I would like to hear your point of view. And I also believe your services will be so helpful and powerful when it comes to another level of barrier. Mm-hmm. You have someone coming into therapy for the first time, and then you introduce the benefits of medication. Mm-hmm. And you have this person, okay, it took a lot for me to come here. Mm-hmm. And now you're telling me to take medication? Here's what I'm hearing, the concerns. It's either, I didn't think it was that serious, or is it going to be addictive? Or I don't know about the side effects. I'm scared about the side effects. And I'm a provider, and my team, my staff, we don't push medication on the first visit. I mean, it's rare, right? If it's necessary, if it's a professional clinical judgment that we have to make, absolutely. And it's an ethical decision that we have to make. But really, we don't see severe mentally ill, but there's some people who can benefit because it's disturbing their sleep, their quality of life. So it's hard to convince them for them to see a doctor to get a prescription for antidepressant or anti-anxiety because of those concerns that I just expressed, right? And so, like I said, okay, we're having the conversations. Okay, people are feeling motivated, receptive about therapy. Okay, but now I don't know about the medication. That's on a whole different level. And I want to hear more about your pharmacogenetic testing, because I do believe, especially when it comes to the side effects, the way I understood the testing, the way I'm understanding, you get tested and this test will tell you how your body will react to the medication, right? That it's going to be favorable. There won't be many side effects or no side effects. And we don't get that type of education when we go to the doctor and we're given a prescription. It's here, take this, and hopefully it doesn't give us an allergic reaction. Hopefully it does work, or hopefully it doesn't give us many side effects. But your testing, this particular testing, can eliminate that and truly facilitate healthcare. So let us know more about that. And that's, let me know if I'm correct, because that's how I'm understanding it.
Yeah, you are correct. I mean, there are a couple of things I want to kind of clear up. But first, I want to go back to you saying that it takes about 8 years for a patient, a client, to decide to seek help. Mm-hmm. And that's a long time to be in a depressed state. I mean, that is a long time to not feel yourself, to stop doing things that you enjoy, withdraw from your community. That's a long time. So to take that first step to say, I need to do something, I think patients need to be applauded for that, and really just thanked for helping themselves stay well. I think the thing with once you seek help, a lot of people will go to a mental health counselor as opposed to their doctor first, which is absolutely fine. I mean, you all have psychotherapy and different programs that you can do to help patients work through, whatever they're going through, whether it's an acute illness, someone passed away, or I lost my job, and I'm just having a hard time struggling with this, or whether it's something chronic, PTSD or anything like that. So I think we need to applaud those patients that take the time to seek help.
Mm-hmm.
As far as the pharmacogenomic testing, yes, so it is a way to kind of look at your DNA, and based on your DNA, it helps guide the treatment options. So it's not going to really tell us whether you will have an allergic reaction to a medication, but what it will tell us is whether your body can properly metabolize the medication.
Oh.
And for a little bit of pharmacology, I don't want to get too deep into it, but in order for a medication to exert its effect in our body, it has to be metabolized and get into our bloodstream and go to the site of action. So in order for that to happen, we must have the genes to make the enzymes to metabolize the medication. If our genes aren't working, as the majority of patients do, when they do a clinical trial, they try to get a wide variety of patients, and so that we can be able to predict what may happen once the drug goes out to the mass market.
Wow.
Well, we know that you can get a sample size, but that doesn't mean the way you metabolize a drug, Leslie, I will. And so that's what pharmacogenomics helps us discover, specifically how you may metabolize Zoloft or another, antidepressant, and how I may metabolize it. It may be completely different. We'd have two completely different responses to the drug. So that's what it does. Not so much side effects, but just how the drug will work in your body and if it will exert a positive effect for you.
Okay. Well, I mean, and that's even better, right? Because like you said, people don't, just even with antibiotics, it may not do anything for me, but it's probably very helpful for someone else if it's penicillin or any type of other antibiotics as well.
And I'll tell you one thing that's interesting. What we do know is that when it pertains to, say, antidepressants, what we know is about 35 to 40% of people fail their first antidepressant. So we have a patient who goes to the doctor, whether it's a psychiatrist or their primary healthcare or their primary care doctor. They'll go to the doctor, and the doctor will ask a series of questions regarding their symptoms, how they're feeling. The doctor will ask about their medical history, their family history, any allergies they may have. As a pharmacist, I would hope the healthcare providers are asking about their financial health. What can you afford? Do you have insurance? Because if they don't get the prescription filled, if they can't afford it, if their insurance doesn't cover it, it's not going to do them any good. So the doctor will ask them those series of questions, and based on the responses, they will make an educated guess as to which antidepressant to try. It's trial and error. And so they'll get the patient on the medication, and that patient may take a medication for 4 to 6 weeks. It takes about 6 to 8 weeks with antidepressants before you realize the full efficacy of the drug. So the patient is on the drug for 4 or 5 weeks. It's not really doing anything. It's not really helping. So they go back to the doctor, and the doctor, well, let's increase the dose.
Yes.
Increases the dose. The patient goes back home, comes to the pharmacy, goes back home, starts taking it. We have another 4 to 6 weeks. That's a long time to be in a depressed state when it's taking you 8 years to even see someone. So that's
I'm writing this down. I'm taking notes. This is so helpful.
That's the beauty of pharmacogenomic testing is if we can get that patient before they see the doctor and perform this test, then they can go into the doctor informed with the power to narrow down that field of drugs to a smaller list. So we're more likely to achieve remission of their disease.
4 to 6 weeks. And I just want to pause and see if we have any questions. I don't see anything, but let me just refresh it. Dr. Pauline, let me know if you see anything on your end.
Yeah, we had one comment that said, many meds you can't afford and patients don't come back to let the doctor know. Oh. We see that a lot in pharmacy where, it'll require prior authorization or it's just not covered at all. And if it's not changed or it's not addressed, that patient may fall through the cracks. And in mental health, it's so important to, you've taken the step to see the doctor. Now let's get the treatment started. So yeah, that's absolutely true.
And you know what's also people need to know is that all mental health clinicians are not allowed to prescribe. Mm-hmm. Only medical doctors are allowed to prescribe. Mm-hmm. And with primary care doctors, what I find is that many primary care doctors are not comfortable prescribing medications for mental health conditions, right? Psychotropic medications. They will do it maybe the first visit or the second visit, but when they see that it needs to be on an ongoing basis, they prefer to have that care to be sent over or to be transferred over to a psychiatrist. And like you said, and I mean, the way you were saying it, the 35% is really like a trial and error. It fails that first attempt, average of 35%. And that's what happens. You have to come to the psychiatrist more frequently in the initial phases because they want to see if the medication works. Mm-hmm. And so you see the psychiatrist within 6 to 8 weeks because that's the time that you should see some type of response. And if there is no response or there's some harsh side effects, okay, so we'll change the medication or we'll change the dosage and then come back and see me next month and see how you react. Oh, that still doesn't work. Okay, so let's try something else. And it's like you said, and so here it is, 6 weeks, and maybe you may have to miss that appointment. So another 6 weeks, and there's a shortage of psychiatrists. You're not going to find a psychiatrist to be tomorrow or next week. It's a long wait list. Always has been a long wait list. And so here you are with your services, it can eliminate that. Like you said, it can definitely eliminate that. What has been your experience working with mental health clinicians and their patient when they are seeking medication for any type of mental illness?
Yes, I mean, we kind of see the same thing you guys see as far as seeing the mental health patients. Many are apprehensive about starting medications. They are concerned about addiction and they are concerned about side effects. I mean, there's some medications, some psychotropic medications that for a lot of people, it makes them feel worse before they actually start feeling better. So imagine you being a patient and you're already apprehensive about starting medications and the doctor, puts you on a medication and you start having headaches and nerve feelings and, your vision may change. And there's some that cause sexual side effects. So, one of the things that you may enjoy, you can't do anymore because of this medication. Many people just absolutely stop taking it. And so it's important to educate those patients ahead of time, to educate them while they're picking up the prescription or even their doctors before the prescription is written so that they know these are things you may expect to see. But, a lot of them with the side effects, if you can get through that first few weeks and, you may have some headaches and things like that, you can still realize the full effect of the medication and have a beneficial outcome if you can just get through those first few weeks. So it's just very important. Communication is so important when you're dealing with mental health conditions. It's important to, when you're with the doctor and you're speaking about the condition, to ensure that the doctor tells you, well, this is what I'm giving you, and this is what we expect to see. Ask the doctors, what should I expect from this? And a lot of times patients will go into the pharmacy and ask the pharmacist, but pharmacists in the retail pharmacies don't have a full picture. Right. We don't have access to your medical records and that kind of thing. So it's important to get that kind of information from your doctor because they have a full picture of what's going on.
And so give us an example. So I'm trying to visualize how this process works, right? Person goes to the doctor, let's say they go to the psychiatrist for the first time. And they're given this medication. I'm the therapist, mental health clinician. Person is reluctant, right? They're scared about the side effects. I'm calling your company, MedsPLUS Consulting. Take it from there. How you and I can communicate and facilitate this patient's care and also alleviate some of the concerns for the patient to take medication. So just this way, we can have a better idea, just have an idea, a better sense of how we all can communicate to improve and facilitate our patients' healthcare and healing process also.
Yes. Yes, so we receive referrals from healthcare providers, mental health counselors, and the patients come to us. And it's a very simple process. It starts out with a consultation. So we just kind of talk to you about your medical history, kind of very similar to what a doctor would do in the doctor's office. Family history, any medications that you've tried in the past, and what your response was to those medications. Once we have the consultation and the patient decides to proceed with testing, we actually have a testing kit that's sent to your home. So this is actually done in the privacy of your own home. It comes with a kit with instructions, very detailed instructions. There's a website that you can go to and actually watch a video on how to conduct the test. And of course, if they have any questions, they can always call us and we'll walk through it. But it's very, very simple. It's essentially taking what looks like a Q-tip and doing what we call a buccal swab. So you just swab the inside of your cheek like a traditional DNA test. The kit also has a container where you just mail it back to the lab, all expenses paid. It's mailed back to the lab and the lab conducts the pharmacogenomic test. We typically takes about 10 to 14 days for us to receive the results. And once we receive the results, we have a consultation with the patient, and we'll also consult with the provider if needed. But we go over the test results with the patient and let them know these were your results. We look at the specific enzymes and determine whether they break it up into different categories. You may be an ultra rapid metabolizer, which means your body metabolizes the medication too quickly. When that happens, you're not able to realize the full effect of the drug, because when you take it, your body burns it, and for lack of a better word, or uses it so quickly, it doesn't have time to exert its effect. And there are some people who are poor metabolizers. Those patients, the drug stays in their body too long. It hangs around too long. So as you continue taking doses, it has the potential to build up in your system, and that can cause toxicity. So that's where you see the really bad side effects and those kind of things. So those are the kind of results that we look at when we do the pharmacogenomic test. And this test does not cover only psychotropic medications. And this is what I love telling people, and they're so amazed. This is a test, it's a once in a lifetime test. You only need to do it one time. And that report needs to become a part of your medical record. So you take it from doctor to doctor, from clinic to clinic, and everyone who writes a prescription for you should review this test to ensure that you're going to respond appropriately to the medication. So this is a once in a lifetime test, and you keep the results and take it to all of your different providers so that they'll know what would be the best medications. There probably, I don't know, the last time I looked at it, there were probably 10 to 15 different classes of drugs, with psychotropic medications being one. So the antidepressants, anti-anxiety, there are diabetes medications on it, cardiovascular medications, antibiotics. So it covers a wide range of pharmaceutical products.
And so the result, this is very thorough. And also I want to share for people who are watching, please share this helpful information, because I'm learning so much. I'm actually taking notes. So you see me looking down, I am taking notes. I love, first of all, I love science. And for people who are watching, please share this information. And when you're talking about the results, the person doesn't necessarily have to have a prescription ready to fill. They will just know, based on, like you said, how the body metabolizes different chemicals with medications, and depending on the conditions that they have as well. If they have a chronic condition, acute condition, is that correct?
That's correct. I mean, I'd love to see for this test to become a part of the medical record, just like your blood test or just like your blood type. We need to know how you'll respond to medications. So this technology has been around for a few years, but in the past, it was really expensive, really expensive. And it wasn't just available to lay people or, for anybody to come and get the test. But now, it's widely available. There are many labs that are offering the test. And I feel like patients really, once they become educated on it and realize the utility of it, I think it's really going to be beneficial. And hopefully it will improve health outcomes in our country, because that's the ultimate goal. We want to be able to diagnose a disease and then give you the best medication to either treat that disease and eradicate it, or treat the disease so that you're able to live on and have a great quality of life.
Someone is asking for your contact information already. We haven't even finished, and someone is asking for your contact information already. So please share how people can get in touch with you. Maybe they have to log off. So please share how people can get in touch with you.
Absolutely. So you can visit our website. It's MedsPLUS, MEDSPLUS, consulting.com. Or you can always email me directly. My email address is Dr. Pauline at MedsPLUSconsulting.com.
Thank you, Dr. Pauline. And someone else is asking, Karina's asking, Dr. Pauline, how much does the test like this cost? So they're asking for the cost of it, yes.
Yeah, so the cost varies just kind of based on what services you'd like to add on. And we'd be happy to discuss that offline because it varies. So I don't want to give a price and then it may not be the same for each patient.
I'm sure. And each patient has different medical needs as well. Exactly. And even with therapy, we also do that, right? That's with therapy. When it comes to therapy, mental health providers, they have to be licensed to do therapy. Not everyone, like if it's only a person who only has life coach, and not to underestimate the work that they do, but life coaches who are not mental health therapists or mental health clinicians cannot diagnose. So we are trained and we are licensed to treat and to evaluate, assess mental health conditions. And just like you explained how you do your assessment, we also do an assessment as far as any type of medical conditions, because I myself always ask, when was the last time you went to go see a doctor? Because there are certain medical conditions that may mimic mental health conditions, particularly when it comes to thyroid, fibromyalgia. There are quite a few mental health conditions that also, right, will affect your medical conditions. And I say this definitely with experience. If I have, I do have clients or have treated clients, they have asthma or they suffer from migraines or joint inflammation. And let me tell you, when they are stressed and they are not serious about their self-care or they don't prioritize it, you start to see the asthma attacks. You start to see more of the migraine as well. And so these are, right, and so you communicating with us as a mental health provider, I have someone who may not need medication for mental health, but they're taking medication already for other conditions. And they're saying, you know what, it's not working. I have to go back to the doctor. I can still refer them to you for other conditions that they're going through, right? Whether it be for migraines or whether it be for diabetes, right? Mm-hmm. And so that's helpful. I mean, that's a great resource for us as well. So it's for any type of medication. But I love, of course, because I come from the mental health field, I love the fact that it's also effective for people who are possibly having that prescription, right? They are possibly having a reluctance to fill the prescription. And so here you come in to educate and help them make informed decisions, or even help them to have a conversation with the doctor, because that's also another issue too. Like, I'm really good with telling doctors, I don't think that's going to work for me, doctor, right? And I know I'm not an MD, but I say, can we explore other options? Or why do you think that's the best approach, right? Other people may not feel comfortable challenging the doctor's medical opinion, but here you are coming with the experience, with the testing, and they can come to their providers, and it's more of like an empowerment, I think, right? It helps empower the patient when they go to the visit, because going to the doctors is not easy. It's definitely not easy. It creates a lot of anxiety as well.
And you know it's very interesting, and that's one of the kind of taglines of our company, is that we want to engage, educate, and empower patients to take control of their health. The patients are the most vital member of the healthcare team. I mean, it's just the truth. And we have to be able to advocate for ourselves. And, doctors are educated. I'm an educated woman. I went to school for a long time to be a pharmacist. And so I would like to think that patients value my expertise and my opinion on things. Yeah. But I mean, I am all for it's about a conversation. It's about what my wants and needs are as a patient before anything else. So I think it's so important for patients to feel empowered. And it's not that you want to cause issues or,
No.
not agree with the doctor, but it's just about, we want to get together and as a member of the healthcare team, determine what's the best course of action for me as the patient. So yeah,
No,
we're all about empowering patients, and you do that through education.
you do that through education, and no, absolutely to respect that opinion as well. And I think for me, I would have to say bias, because I would think I'm biased because I have that knowledge and working in healthcare, and so I have these questions, and excuse me, but it's always coming from respect, and I'm glad that you pointed that out. But also having the, just having that sense of that you're in a partnership, like you're working as a partnership with your healthcare provider, and therefore there is a mutual exchange of information and questions as well. And like you said, the more educated the patients are about healthcare and about what works for them based on their medical needs, the more empowered they are, and possibly the more engaged they will be and compliant they will be when it comes to their medical regimen, right? And their routine as well.
Yes, absolutely. I mean, we know that the medication cannot work if it's not taken, if it's not picked up and, and taken. And so to educate that patient on the importance of the medication, on how it will affect the disease state, how it can improve their quality of life, all of that is so important in order to help with adherence and to ensure that they achieve positive outcomes.
And let me pause. Do you see any questions, Pauline, Dr. Pauline, on your end?
Let's see, there was one that's asking about which test would you recommend for a patient to determine if a patient may have diabetes. So actually for that, I mean, that doesn't actually require a genetics test. Now, there is a test that can test your DNA to determine if you may have a genetic predisposition to diabetes. And so we do offer that test as well. So if you want to go to our website or contact me, I can give you information on that. But as far as diabetes, that's actually can be tested. They're actually over-the-counter tests that you can either check your blood sugar or check what's called your A1C, and that'll let you know that. So not to get too deep into that.
I appreciate
this conversation, but yeah.
No, you're right, Dr. Pauline. We actually see a lot of pre-diabetes in my practice, and the more I read about it, the stress level, I was very surprised to see that the stress level, how it affects your blood sugar, your glucose level, right? So the A1C, that test will determine if you're pre-diabetic, and this way you want to catch it, the pre-diabetic phase, because you can alternate your diet. But I was very surprised to see how the stress level affects your glucose level, right? Your insulin absorption. And people don't know that, because I see a lot of clients who are, or, clients in the past, pre-diabetic, and they're very young, very, very young. And I'm not sure if that's the case that you're seeing as well. They're very young. Yet some have family history, some don't. But what I'm seeing that's common is that the stress level is very high and it's not taken care of. There's a lack of stress management. Because I believe there's no such thing as stress-free, because there's good stress and bad stress. So there's no such thing as just no stress at all in our lives. But yes, there is stress management, and that's key. There's stress management.
Yeah, and I think that's important, in your role as a mental health counselor, is helping people manage that stress, because like you said, nothing is stress-free. We all have stressors, but it's how you manage it. And some people can manage that speaking with you, doing different types of psychotherapy, cognitive behavioral therapy, and you can speak to those type of things. But there are some people whose symptoms are so severe that they have to kind of proceed to taking prescription medications. And that's why I think it's just important to be assessed by a clinician, because they can decide whether you may be able to, do some type of talk therapy or services that you offer, or whether you need to see a doctor and be prescribed medication.
And also there is not a lot of research, but there is research stating that some people who just prefer to take medication and not speak to a licensed mental health professional like myself, they just rather go and take the medication, because it takes courage to come in for so many years and talk about your trauma and talk about all that you've been through that you've never shared with anyone before. And they say, well, I'll just go to my doctor and get sleeping pills and I'm okay. So when you see the research, the medication alone is not as effective as therapy and medication combined. So combining the two is very powerful. And if you don't need the medication, therapy itself is it's very powerful as well. Of course, you don't want to rely on medication if you know that there are other ways that you yourself can, you can use other tools. But if medication is going to be helpful, absolutely. I mean, I talk about it too. Like, okay, you know what? We've tried different techniques. I believe you need to see a psychiatrist. We work closely with a psychiatrist and we give them education about it. So I totally agree. I totally agree with what you're saying. And I believe someone is talking about the insurance coverage. Or did you cover that already, Dr. Pauline?
I have not. Okay. At this time, the tests are not covered by insurance. The last article that I read, though, it looks like one of the major insurers in our country is looking at getting the test covered. Especially for those patients who failed, a previous therapy. So, I mean, to me, I think that speaks to the utility of this test and how important it is for managing disease, that insurance companies are willing to pay for it, because they realize if we can get you on the correct medication sooner rather than later, it will not only decrease costs for them as a payer of your insurance, but it will also improve your quality of life. It will improve your productivity, because you are now able to work and go back out into the community and do the things that you enjoy. And it hasn't taken us 6 months to get to this point. We're able to get there a lot faster. So I think the insurance companies deciding to cover this is kind of letting, the world know that pharmacogenomics is very important for just shortening that time to remission.
And this particular testing is an investment in our health.
Oh, yeah.
Right? And so people should not, I understand that cost at times can be a barrier for some, but this is one-time testing. Is that correct? If someone is getting older, do they need to get tested again to see which medication would be effective, or this is one time? I remember you said that, right?
Oh, this is a one-time test. Your DNA does not change. So now what we know about the information may change. So the way that the test is formulated, it's very kind of technical, but it gives you the specific gene and it tells you whether you're a rapid metabolizer or a poor metabolizer, all those things that I talked about earlier. So what we know about the medications, that knowledge may change, but your DNA won't. So you'll only need to have the test one time and we can just carry that information with you for your lifetime. So yeah, you're absolutely right in saying that it is an investment. I know that pharmacogenomics has been used a lot in like the cardiovascular health. You have patients who need to get heart stents after a heart attack or something like that, and they are often placed on blood thinners. Well, there are some people who don't respond to the blood thinners that the doctors prescribe. So imagine being post-heart attack. You have stents placed in and you need to be on a blood thinner, but genetically your body can't process the medicine that will essentially keep you alive. Wouldn't it be great to know that beforehand rather than later? That's the power of pharmacogenomics. You're able to know that beforehand. So your doctor knows, okay, I can't prescribe this specific medication. I need to use something else.
And the pharmacogenomics, think about when you go through the trial and error that you were mentioning, right? Going back to the average statistic of 35% is pretty much like a failed trial and error phase for the first medication that's prescribed. So there is time that you have to take off from work to see the doctor. You're paying for any type of, for those who are really wondering about the health insurance, right? Look how you're still spending. You're paying either way. So it's the time that you're spending to go to see the doctor. You have to take time from work, or if you're a business owner, right, you take time away from your business, and then the co-payments or that's what it is, like the co-payments that you have to provide at the doctor's visit, and then also for your medication. And guess what? That medication doesn't work. So now we have to go back to the doctor, or possibly, make a call. Maybe the doctor will say, okay, well, just call the office. So that's time that you have to take to call the office, get through to the doctor, go back to the pharmacy, another co-payment for your medication. And we're hoping that works. And we're not sure if that works. So it's still an investment. You're still paying as far as with money, and you're also paying with time as well. And there is, for people, you want to check for if you have insurance that's based through your employer. You also want to see if you have a health savings account. At times that may cover the cost as well, the health savings account. Or you may just want to call your insurance and say, is there any type of coverage? Perhaps they may cover a percentage or so. You just never know some of the benefits that your insurance can offer you for these testing. And like you said, maybe right now it's not covered, but in the future it is. But health savings account, they tend to be very flexible when it comes to coverage, as long as it's for medical care. So just wanted to inform people who are watching or watching on a replay to make sure that if you have a health savings account, you would have to make sure to call your employer if it's an employer-based insurance and find out as well. So that's another resource that so many people do not know. I also share that information when it comes to therapy. Some people are quick to say, oh, you're not part of my insurance network. I need to just call my insurance or call someone who does take my insurance. But there is a plan, often depending on the plan that you have, out of network plan, right? So there's the in-network plan where the doctor's in network and you pay your $15 or $20 copay, but some plans have out of network. So let's say we are out of network provider. The insurance company will say, okay, these are the common coverage that we see. The insurance will say, okay, well, the provider's not part of our network, but we will cover 50% of the cost. Or you have a deductible of, let's say, $2,000, and then we'll cover 100%. But people, we find, not everyone, but I just want to make it clear how this is an investment. You're still paying. If you're reluctant to do so, you're still paying. There is a shortage of us. And the people who do accept your insurance, oftentimes, they might be booked. And I am finding more and more providers who no longer want to take insurance. And, I won't even go into the political aspect of that. We have to really think about the investment that you're willing to do with it when it comes to your lifestyle as well. And when I do give this information to people, I say, look, if you want to make sure that you use your insurance, perhaps we're not in network, right? We take 2 insurance plans here at Counseling Space, but other plans, I can say to them, look, make sure and see if you have out of network, because believe it or not, many plans do, and you may not have to pay much for every visit. So going back to your testing, your pharmacogenomic testing, it might be covered from a health savings account. So just wanted to give that resource and background for people who are watching.
That's a great point. Great point.
Thank you. Thank you. Do we have any other questions?
Let's see. Someone has asked, what's the long-term benefits of genomic testing? And again, it's just like I spoke earlier. The primary benefit is that it helps guide your treatment. And it's not just for mental health conditions, but like I said, it's for cardiovascular disease, diabetes, antibiotics even. We are able to determine if the medication will possibly work for you better than others. So to me, that's a long-term benefit. And to me, the investment is absolutely worth it to know that information ahead of time, because I can't tell you how many patients pharmacists see day in and day out that come in with a different prescription every 4 or 5 weeks, or an increased dose, or 2 or 3 different medications. And it's because it may not, based on your genetic makeup, be the correct medication for you. And we now have a way to know that ahead of time, which I think is incredible.
Now, Dr. Pauline, what made you decide to start MedsPLUS Consulting?
Yes, so I have practiced community pharmacy for 15 years, and I love being in a community pharmacy. I love the patient interaction and just being able to help people answer their questions, help them achieve their healthcare goals. But one thing that I noticed is that people are getting to spend less and less time with the pharmacist, and that's across the board. I mean, pharmacists are busy. As I stated earlier, people are taking anywhere from 8 to 10 prescriptions, a day. And on top of that, our baby boomers are getting older. So the number of prescriptions that we're filling now compared to when I started 15 years ago has increased exponentially. I mean, we are filling a ton of prescriptions in the pharmacies. Our pharmacists are. And so one thing that we decided, my partner and I, is that we really wanted a way to be able to reach patients and offer them comprehensive care, to be able to sit down across from them. Or, we also offer telehealth, different types of options for those patients who can't get to us. But to sit down and be able to have a conversation, what are your health goals? What are you attempting to accomplish? How's your quality of life? And how do the medications that you take affect those things? So are you improving? If you have diabetes, what's your A1C? Many people don't know. You'd be surprised the number of people who have hypertension and don't know what their goal blood pressure should be.
Yeah.
And I just don't think that, we can't improve outcomes if the patients aren't educated and informed. So that's why we started the company, just to be able to have the time to have those comprehensive conversations with people and really address their needs and their goals and be able to work to achieve those goals.
I'm very excited about this because this is a great resource. I'm all about resources. I want to put your resource on our website. We have a resource site, and I want to put your company on our website and definitely share this resource with so many. I would say the clientele that we serve, who are mostly business owners, they will be very open to this because anything that relieves, saves them time, because they're always in a rush, they have too much to do. And when I approach it in a way that not only this is great for your healthcare, right, for your healthcare process and your healing process, but it will save you time. And that statement, trust me, will be a great selling point as well. So that's definitely something I want to be more mindful and share with others as well, that this is a powerful resource. And let us know what's next. What's next for Dr. Pauline, and what are people expecting? What should people expect to see from you moving forward?
Yeah, well, I mean, my thing is just educating people, like I said, on the utility of pharmacogenomic testing. We are talking with mental health counselors. We're talking with psychiatrists, primary care physicians, letting them know that this is information that your patients need in order to live well and live their best life. So we're educating practitioners. Eventually, we want to possibly get to the point where we're able to get into some small businesses and let them know, if you want to increase your employees' productivity, we need to be able to offer, disease state management programs and things like that. So, the sky's the limit. I am just open to opportunities and possibilities. I keep my heart open, my mind open, and I'm just excited about what's next.
Oh, I'm excited for you, Dr. Pauline. I also, I would like to ask the viewers, have they even heard of this service? Drop the comments below and let us know yes or no. If this is new information as well, yes or no. And anything that you want to share with us. Because like I said, this was new for me. I appreciate it. You and I met through, I think it was a business Facebook group. You had reached out to me just supporting what I do. And I really appreciate it. And we kept in touch. And then you started marketing your business. And I said, okay, I see what Dr. Pauline is doing. And then I said, I need to speak to her. We need to get together and talk about what she's doing, because I myself had no idea about this service. I really didn't. And I've been working in healthcare for a very, very long time, almost 20 years, and I didn't know about this. So
yeah, I speak with mental health counselors often. And when I tell them about, how the test works and kind of go over some of the things we discussed tonight, they're amazed. They're like, I know patients or clients that will benefit from this. Absolutely. And, especially those that are kind of apprehensive about starting medication. They're like, I know patients that will benefit from this. And, to get the medication right sooner rather than later, it's priceless. Saving time, money, heartache, side effects, it's just priceless.
Absolutely. Let's see what people have to say. They have not, someone said, I have not. I'm so enjoying the dialogue. Thank you so much. Thank you. I'm enjoying it as well. Thank you so much. Very informative as well. Yes, let us know what comments. I mean, we have to have this conversation again online if there are other questions that people have, because like you said, it's not only for mental health, it's just medical conditions as well. And that is so important. But I have a question. What are the trends that you're seeing? What are the changes? Because you've been practicing as a pharmacist for a very long time. What are you seeing, let's say going back 5 to 8 years back to what you're seeing now? And the reason why I'm asking this question, it was prompted when you said we're filling so many prescriptions nowadays, but particularly with mental health, what are you seeing from a point of view?
Yeah, I mean, primarily we're seeing what the statistics say. Anxiety and depression are the two most common mental health conditions. And with those patients, it's often taking multiple medications at, alarmingly high doses. When we're in pharmacy school, we're taught the average dose for certain drugs. And so we're seeing much higher doses than we would normally, what we would think we should see. And we're also seeing combinations of drugs being used that in pharmacy school, 15 years ago, it was kind of like, I don't know if you should take these two together. But I mean, and things change. I mean, we learn more as drugs get out to mass market. We learn more about the effects and things like that. But just the number of medications people are taking, and it's, what we consider young people, our baby boomers, we know that they'll have arthritis. We know that they'll probably have high blood pressure and diabetes and those kind of things. But we're seeing younger people have these chronic diseases as well. And, to start someone on insulin or different medications so young, a lot of times we don't know the long-term effect of taking, an antidepressant medicine for 40, 50, 60 years because they started so young. So that's kind of the trends we're seeing, just large, high doses and combinations that kind of make us pause a little bit sometimes.
No, it's interesting to know. Definitely interesting. Yeah, we're also seeing more. I mean, even with children, you're starting to see that too. You see with a lot of with children, and that's not something I was seeing when I started working in the fields. And now you're starting to see more awareness when it comes to children mental health as well. So that's another.
I think it's a great thing. I mean, I remember, being a child and we would have kids that, and they would use these terms that, of course, now we try not to use. Just something's not right, or those kind of terms. And now we're able to identify what is not right, and we're able to treat that, which I think is phenomenal. And also, one of the useful points of the pharmacogenomics test is as it pertains to like ADHD treatment. I had a patient not too long ago that had been diagnosed with ADHD. She was a 14-year-old little girl. And she had been taking medicine for a while, but her mom was like, she starts off really great, but about 12 or 1 o'clock in the afternoon, it's like she has no drug in her system. She loses all of her focus and she's inattentive, that kind of thing. And so we did the test on her, and it turns out one of the enzymes that metabolizes the medication that she was on, she is an ultra rapid metabolizer. So the symptoms that her mom was seeing we were able to look at it in black and white on the report to show that her body is just using that drug so quickly, she's not able to achieve all of the effects. So yeah, in children's mental health, this test is absolutely useful.
And also going back to my experience working with clients and just wanting to encourage anyone who's watching, whether it be now or during the replay, and that something is not right and you're just holding off, and you have children, they will pick up on it. I cannot tell you how many times I will see a client for the first time, because of course with treatment, there is the education piece, right? Like you said, to educate and to empower our clients is mostly with education. That's a huge part of treatment, to educate them why you're experiencing these symptoms. And going back to the assessment piece, family history is also discussed. And I cannot tell you how many times they'll say, I think my mom was depressed. This is what this is why my grandmother was acting a certain way, right? There is a huge correlation between the family history, even when it comes to mental health, and also whether the children actually will pick up on having mental health conditions or having unhealthy coping skills when it comes to stress or any type of trauma. And so I say that to say, it's very likely that your children will pick up on it. You think you're hiding it, but I cannot tell you how many times when I educate people about what's going on, and they will say, oh, that makes sense. That makes sense why we don't get along. Or that makes sense why Uncle so-and-so, no one is speaking to Uncle. Just the family dynamics and people try to hide it. But when they're educated, because I do see that the millennials are more vocal than your baby boomers, right? They're more in tune about, okay, I need to get my mental health straight, the millennials, right? And they tend to be the only ones to break that cycle because their parents, their grandparents are not open to it. And then they start to realize with education that, oh yeah, there are people in the family that do suffer. It was not officially diagnosed, but they now have an understanding why they have these behavioral problems or unhealthy coping skills too. So I just want to just encourage people who have children and they just feel scared. Listen, it will definitely improve your relationship with children or people in your lives. And you don't want these you don't want these years to pass by and your children, they learn based on what they see, really. That's what it is too. So going back to child mental health care, what we've seen, even though we don't see children, but what I start to see is that once the parent is starting to get treatment and stabilize, the relationship with the child is also shifting as well. And that's powerful to see. I mean, I've heard comments where I believe it was last year saying, "It's good to see you smile, mommy."
Mm-hmm.
The client's child said that to my client's child said that. It's good to see you smile.
And you know what? The children feel your energy. So even though you may have a smile, but a child can tell an authentic smile versus I'm just trying to put on this smile so that we can get through this day. They know. So yeah, it's so important. Yeah.
So I'm going to wrap up. I respect your time. I appreciate your time, Dr. Pauline, and I also hope we can do this again. And I want to make sure before we hang up, if there are any questions or comments from the viewers, let us know before we end. And while we wait, let people know once again how they can reach you.
Yes. So you can always visit our website, which is MedsPLUSConsulting.com. And after the video is over, I'll put a link in the comment bar so that everybody can see it. Or just email me directly. My email address is drdrpauline@MedsPLUSConsulting.com.
There you have it. All right. Make sure you contact MedsPLUS Consulting. Thank you so much. And thank you everyone for sharing, for watching, engaging, and let us know if you have any other additional questions. Please feel free to drop them below and we'll be in touch. Absolutely. Thank you so much, everyone. Have a good night. Thanks again, Dr. Pauline. I appreciate it.
Have a great night.
You too. Take care.
Bye-bye.